Doctor, this is a very common question. If patient is having recurrency of getting urinary stones, how we can prevent it?
Stone recurrence has various factors, madam. To know about the stone recurrence, it is basically, we know some simple things like first part will be that water intake is important.
Yeah.
If you are not forming adequate urine, then the kidney's job is to excrete harmful products from our body.
Yeah.
Now, whatever is excreted, they will get crystallized. If your urine is concentrated, so if you have a glass of water, if you go on pouring mud into it, a time will come when you cannot dissolve it. It will form a crystal down the glass.
Yeah.
Similarly, when the kidney is not throwing out enough urine, so whatever crystals are coming out of the kidney, which is its work to throw out excrete the waste products from the body. So this will crystallize in the kidney and gradually will form a big stone. So first important thing is water.
Okay.
To prevent, water intake should be adequate. Second is to know that it's a very complex pathophysiology, but to be more simplified, the urine throws out, the kidney throws out in the urine calcium, oxalate, uric acid, and citrate. Now first three things, calcium, uric acid and oxalate, if there is concentration is more in urine, there will be more chances of stone formation.
Okay.
So we have to devise a way by which calcium, oxalate and uric acid which the kidney throws out in urine is decreased.
Okay.
Now citrate is the fourth thing. The citrate increases the ability of the body not to form a stone. It prevents stone formation.
Yeah.
So calcium, uric acid and oxalate should be less and citrate should be more. So this is the second preventive strategy. Now what increases the citrate in urine? So if the citrate is more, as I said, the urine will be the environment of the urine is such that the stones cannot form. Now increase in the intake of green leafy vegetables, not dark green. Dark green in fact has more oxalates. All vegetables.
Okay.
I will not say green leafy, I will say all vegetables.
Okay.
Except dark green vegetable. If you increase in the intake, if you have a lot of fresh fruits, if you have a simple like or lemon, these are the things which has a lot of citrate. So urinary citrate excretion will increase. Number two is that in this part is that if we decrease the intake of acidic food, more especially non-vegetarian food. This non-vegetarian food in excess increases urinary acidity, meaning by it decreases citrate.
Yeah.
Decreases citrate excretion, so there will be more propensity of stone formation. So we discussed about water. Second is how to increase citrate by taking a lot of fruits and vegetables. This is and decreasing the intake of non-vegetarian food.
Okay.
Now another part which is left is how do we decrease the calcium citrate and calcium oxalate and uric acid. Now it is said that if I take more calcium then I will form stones. It may be true, but not taking calcium is not right.
Okay.
Because if you are not taking calcium, the body will take out calcium from your bone.
Okay.
You will in fact, so decreasing calcium intake, or for example somebody is postmenopausal, she takes calcium supplementation, she don't need to stop it. Normal calcium requirement is around 1 gram per day. 1 to 1.2 gram per day is the normal requirement. It comes in our diet. So you should not restrict calcium in any way. You should take normal calcium. Don't have excess calcium. Like you are having a lot of calcium supplementation, more than what is recommended by our doctor. It may cause a lot of calcium excretion in urine. Number two, a very important cause of calcium excretion in urine, high sodium intake.
Okay.
Common salt. If you take more of salt, more calcium is excreted in urine. So one strategy will be to decrease the salt intake. A very good strategy to decrease calcium. Uric acid. More of non-vegetarian food, more of protein, high protein diet will cause a lot of uric acid in urine.
Okay.
So you can just decrease the intake of protein. Some protein is required for your body. You cannot say I will not take non-veg at all. I require around, normally person require around 1 gram per kg body weight. So 80 kilo person will require 80 grams. 70 kilo person will require 70 grams. One standard egg or standard piece of fish or 3 small pieces of chicken will fulfill the requirement. But if you have a half a kilo of chicken daily, you are inviting uric acid. More uric acid in urine, you are inviting a stone maybe.
Right.
So it should not be zero. So calcium, uric acid, and next, last but not least is oxalate. A high oxalate in urine is responsible for stone formation. There are various factors which changes the oxalate in urine. This is too detailed. But a simple thing like high intake of all the nuts, like if I say like almonds, like chocolates, coffee, they're all seeds and nuts.
Okay.
They are rich in oxalates. Intake of this should be reduced.
Okay.
Number two, green, dark green vegetables are rich in oxalates.
Okay.
So palak आपको बंद नहीं करना है, कम करना है. आप थोड़ा सा लेते तो कुछ नहीं होने वाला.
Okay.
And all the seeds, including say tomato is a common fad is that tomato should not be taken. So the seeds which may have some oxalates, but anyway we take out the seeds to make it. So I feel you can take it. So foods rich in oxalates are usually all the seeds, this our nuts, all the nuts, beer. It's a wrong notion that drinking beer will reduce stone. No, beer is rich in oxalates.
Okay.
It will increase stone formation rather.
Okay.
So these are the things. So fluid intake. So prevent stones. We think about increasing our fluid intake, reduction in sodium in our diet, reduction in oxalate-rich food like nuts,
Yeah.
tea, coffee. Like if you don't have beer,
Yeah.
you should decrease the intake of very dark green vegetables.
Yeah.
And third is uric acid should be decreased
Proteins.
by decreasing the intake of non-vegetarian food. And fourth is you can increase citrate of the urine by taking a lot of fresh fruits and vegetables. This will be a good strategy to prevent stone formation. So
Yeah.
diet is not very important, rather it's more of water intake and less of sodium intake.
Yeah.
And taking everything in adequate amount.
Correct.
So
correct.
this is the way. It's not that
Yeah.
diet is if I tell you stop this, you will end up stopping everything.
Right. Right.
Not so significant.